Casey.
I'm Eli.
And our research question is, do communities in the United States prioritize solving the issue of homelessness?
Basic needs necessary for well-being include food, water, shelter, and clothing. However, many people around the world do not have a permanent shelter to call home. According to the 2018 Annual Homelessness Assessment, a homeless individual lacks a fixed, regular, and adequate nighttime residence. He or she may live on the streets, in a shelter, or in their cars.
A 2018 report written for Congress reveals that approximately 552,830 people in the United States were homeless in January of 2018, and children under age 18 made up 20.2% of this number.
Besides consequences for homeless adults, children and homeless families experience profound negative effects as well.
First, children suffer academically. They have low standardized testing scores, about half will be held back by at least one grade level, and they are less likely to graduate school.
Next, their physical well-being is affected. Homeless children are at high risk for infectious diseases, chronic health problems, and nutritional deficiencies.
Their mental health suffers through high risk for psychological disorders. The National Healthcare for the Homeless Council reports that the rates for homeless youth having at least one psychiatric disorder are 4 times the rate of youth in the general population.
Finally, they demonstrate poor and dangerous behavior and have a substantial increase in suicide risk. Drug and alcohol usage, as well as an increase in violent behavior, has been reported to be far more common among homeless youth.
Thus, these effects call for an immediate intervention of the homelessness problem to prevent future issues for these children. Not only must children receive aid, but adults who may become potential parents one day need assistance as well.
One potential solution is for more income support services to financially support homeless individuals or families. Financial assistance can allow the homeless to get back on their feet, as poverty comes hand in hand with homelessness. However, income assistance programs may not have the proper stability needed to fund the homeless and may not allow them to escape their plight.
Another solution that may give the homeless more security is rapid rehousing, in which homeless individuals are provided short-term rental assistance. The benefits of this solution are that the homeless are able to obtain housing quickly, their self-sufficiency increases, it can be cost-efficient, and they're able to receive treatment in those services.
However, rapid rehousing cannot be described as anything more than a short-term solution, as it does not provide permanent housing and may not effectively solve many of the negative effects on homeless children. Because a long-term solution is needed, we propose that communities implement permanent supportive housing for the homeless with voluntary support groups such as food banks, volunteer tutors, and substance abuse support groups.
So first, what is permanent supporting housing? According to the National Alliance to End Homelessness, it is an initiative that combines affordable housing assistance with voluntary support services to address the needs of chronically homeless people.
Thus, buildings can be built or renovated into apartment complexes for the homeless in which they eat, live, cook, and sleep in their own units.
Besides providing the homeless with shelter, our proposed solution also includes supportive systems. While individuals pay a portion of their income for rent, they also have the ability to participate in complementary services aimed to improve their well-being within and beyond the housing facility.
In addition to outside funding, both federal and charitable, housing systems partner with local organizations and service providers to teach residents how to access local resources such as the Homeless Children's Network.
One way to improve children's academic success is to designate study areas with the appropriate school supplies. In fact, a provider at Treasure Island Supportive Housing reports that in the after-school program, kids are now spending an hour doing homework. It has been a real big achievement. Thus, when children are in a stable housing environment, they can focus on their schoolwork and take advantage of the services provided to them. Study areas included in these housing facilities can allow students to better comprehend the material outside of school and thus improve their academic achievement. Another way to improve children's school success is to invite volunteer tutor organizations to the site. As a volunteer tutor at the Los Angeles organization called School on Wheels, Larissa Trevano describes to us in an interview how she and other members help homeless children with their schoolwork. In fact, this organization's annual 2017 report states its high success rates. 93% of parents saw more confidence in their children in either reading or math subjects, and student grades increased by about 1.5 grades after tutoring. Thus, these results convey the effectiveness of tutoring homeless children. Similar organizations like these can assist students in these housing facilities with their schoolwork to warrant positive educational outcomes.
Can support services improve children's physical health too? One way is for volunteers to run health and nutrition workshops inside the facility. A study found that low-income students in nutrition classes increased their vegetable and fruit intake daily and were more likely to select a milk with lower fat content. These results suggest that children absorb what they learn in health workshops, and implementing these programs in housing facilities may improve homeless children's physical health.
To address mental health, community events can bring a sense of connection. In the Cecil Williams House, parents frequently make breakfast for the children in the facility. A service provider relays that gathering for meals that allows the children to build a sense of family that they might not otherwise experience. Thus, organizations in these permanent supportive housings can frequently sponsor community events such as birthday parties, game nights, and movie nights to increase residents' sense of belonging and happiness.
Finally, there are a variety of services to address the behavioral disadvantages of homeless individuals. If tenants experience substance abuse, local organizations can organize support groups such as Alcoholics Anonymous, Freedom from Smoking, and Narcotics Anonymous from within facilities to reduce behaviors. A 2017 study found that 33% of people who attended AA meetings were sober for more than 10 years straight afterwards. Based on this sort of long-term success, it's clear that adults participating in these sorts of meetings may stop irresponsible behaviors, and as a result would model better behaviors for their children to follow.
So what are the possible implications of this solution? First, the homeless population where these supportive housing facilities exist may decrease. In 1990 to 1993, the New York Agreement supplied 5,225 homeless with services and shelters. This supportive housing initiative decreased the number of homeless adults in shelters by 37% over 5 years. This New York initiative proves that permanent supporting housing can reduce homelessness within United States policy, thus preventing negative consequences for the children.
Second, the economy may benefit. Researchers comparing the service use of tenants before and after living in LA's supportive housing units found that for every dollar spent on supportive housing, the LA County retained $1.20 due to reduction in costs elsewhere. Thus, moving the homeless into these housing facilities is actually more cost-effective than leaving them in unstable housing conditions. Less public funding is necessary for these facilities and can be put towards other causes.
Despite the positive outcomes, it is also important to address the possible negative implications of our solution. First, the tenants in these housing facilities may continue to display poor behavior. Thomas C., a previous tenant in permanent housing, relays in an interview that he thinks that there was illicit drug activity in the rooms near him. Despite support systems offered, some tenants may take advantage of the independence they have behind closed doors in their own apartments in these services.
Secondly, community members may object to having housing facilities in their neighborhoods. For example, neighborhood members in Fullerton have expressed their disapproval for the building of an apartment complex for the homeless.
Enough going on with the homeless. They're leaving their needles, their drugs, their messes. But we are not going to stand by and watch you ruin our neighborhood more and let this come in. We will sue you.
Community members may feel uneasy, as you can see, because these facilities may attract homeless people into their neighborhoods and, as a result, infringe on their personal feelings of safety.
However, the positive implications for the homeless children, adults, and the community outweigh the negative ones.
Communities should prioritize these children's well-being over all else.
We must work towards solving homelessness once and for all.
Small actions from individual communities, when coming together, will add up to create a great overall effect throughout the United States.
Thank you.
Casey, the first one's for you. Give one specific way that your thinking changed as a result of Eli's findings.
So my perspective was psychological and Eli's was behavioral, so those were pretty interconnected, which we found in the beginning of our research, and we distinguished that mine being more mental health oriented, and his being more like action oriented. So we found a lot of similarities, which we mentioned in this presentation, regarding high rates of depression and anxiety leading to these behaviors of substance abuse, alcoholism, and all that different type of behavior. So I felt like those were really interconnected the whole way, and throughout that we were able to apply that to our solution, which is where the supportive services came into more reality, as where in mine it was more community events and services that can help provide a sense of collectivity, and his was more that help with substance abuse and alcoholism that can provide a more sense of stability.
Eli, what is a way in which your team's resolution makes you think differently about your own individual research?
Alright, so our solution may be really helpful for the stability that can be built for these children whose livelihoods have been threatened by these situations and what has come from these situations. These support groups that we've researched, such as AA and Narcotics Anonymous, can help eradicate this this addiction, this negative behavior, and that so many homeless children experience in today's day and age. It's really maybe hopeful that by the time the next generation of children come around, we might not have such a large population of them being homeless.
Alessa, what was the strongest counter-argument to the solution or conclusion your team identified?
So we thought that the strongest argument was the Fullerton clip that we played, and that was a clip from a city council meeting, and that just showed the negative thoughts about these housing facilities as it may increase like more homeless into their neighborhoods, or it may infringe on their feelings of safety. And you can just see like the disapproval, like they were saying, we don't want your needles, we don't want your drugs, we will sue you. It just shows that this is like a big counter argument, because this is one of the biggest arguments against these shelters, because they could attract homeless people, but I think in the end we all have to realize that this is a big issue and we just need to take steps towards solving this issue. And plus we need community consent in order to, for example, if like the city may not approve the building of these facilities if we do not have neighborhood consent. So that was just one, that's why I thought it was the strongest.
Great. And Alana, to finish, in the future, what change would you make to your group norms, and how would you expect that to improve your team presentation?
So in the beginning, we established that communication would be like our priority group norm. So I think we did a good job like dividing up the research, sort of telling, like being accountable for what you were doing, but of course there's always room for improvement. So what I would say is, with like task delegation, instead of splitting up, which is what we did, we had Casey and I do the support systems, and Eli and Alexa did the actual housing part with the evidence, such as the New York agreement. And I think that instead of doing that, if we had each person do their own perspective and the support systems within that perspective, then that would allow us to use our own research to create a better solution.
Good reflection. Thank you all.